The process of genetic counseling and testing follows kind of a pattern of where an individual is first referred to a genetic counselor. They spend maybe 45 minutes to an hour in depth going through that personal history as well as a family history and information regarding the testing of particular genes that are most appropriate based on those histories presented. At the end of the session, if the individual so chooses, they would undergo a sample collection. We can either take a blood sample or a saliva sample so that the DNA or the gene can be analyzed for changes within it. So we here at Baylor see a lot of individuals coming in for breast cancer diagnosed at very young ages, so often before the age of 45. We're also seeing individuals who themselves may have not been diagnosed with a breast cancer but have a remarkable family history that's been picked up by one of their practitioners, such as an OBGYN or a high-risk surgeon that they're seeing. The testing for BRCA1 and BRCA2 testing is very accurate and reliable at this point in time. There may be some differences between labs in how they are offering the technology, but we say that the sensitivity and specificity are about 99% or higher. The majority of the time when individuals do come in, I'd say we're obtaining negative results, meaning they do not have one of these genetic mutations identified. This may be because of a number of different reasons. It just goes to show we need to do more research in terms of different genetic mutations that could be at play in the development of breast cancer. To put it in perspective, we talk a lot about the BRCA1 and the BRCA2 gene. However, in our bodies, we have more than 22,000 genes. So again, it's for us as researchers to really catch up and better understand the genetics or hereditary component of breast cancer. So for women who test positive, there are many options, one of which include a prophylactic double mastectomy or the removal of both breasts. We see that's a common decision many women make due to the fact that we see the greatest risk reduction coming along with that surgery. However, it's not a correct decision or something that feels right for all women in this position. Many women feel that screening may be a better option for them. This would be increased screening. So what we would recommend is MRIs and mammograms to be performed on an annual basis. Usually we would have them spaced out every 6 months. Again, it's just dependent on a woman and her personal decision as to what's best for her. There are many different books even now that go through women's journey in trying to make that decision and provide some insight that can be very helpful for an individual facing those difficult decisions. So hearing the word mastectomy for any woman can bring up a lot of different emotions of both fear and anxiety. From years and years ago, if you remember, if there was any family member that you may have seen undergo this surgery, they were very drastic. There was not much attention truly given to what the reconstruction or cosmetic outcome of these surgeries might look like. Now we're in a time when there are many different options available to women who may be considering mastectomy, whether that's prophylactic or before a breast cancer occurs or for a treatment option. We also have great platform speakers such as Angelina Jolie, who's moved forward and been brave enough to share her story of undergoing a prophylactic double mastectomy, especially being in the industry she is in, surrounded by beauty, and that's been very empowering for many women facing those difficult decisions. So for women who are out there listening to this interview who may be interested in better understanding their own personalized risk for development of breast cancer as well as perhaps other cancers, we would definitely encourage them to come in and meet with a genetic counselor to assess those factors of personal history, family history. Going through a diagnosis of breast cancer, whether it be for oneself personally, a loved one, or a family member, can be very difficult. Obviously, there's a lot of fear and anxiety that can come by knowing of a cancer diagnosis. By meeting with an individual such as a genetic counselor, we hope to alleviate some of those feelings and to better understand what that individual's risk may truly be.